Speaker Series, a program showcasing the inspiring careers of highly successful and influential women and provides the opportunity to share their knowledge and experiences with students and alumni. I want to thank those of you who have participated in the past and have returned to us today, and I also want to thank those of you who may be joining us for the first time. We hope you return for future speakers. Before we begin, I'd like to take a brief moment to highlight the Women's Leadership Council. Led by a group of alumni volunteers like myself, the URI Women's Leadership Council supports and enhances the personal and professional growth of URI women by cultivating meaningful opportunities to unite, celebrate, empower, and learn from each other while forming lasting connections and relationships in the community and beyond. Additionally, the Women's Leadership Council supports and promotes the Women Transforming Women Endowed Scholarship, a scholarship that's awarded each year to a woman-identified student who holds a leadership position and maintains a GPA of at least 3.0. Now, about today's program, this session will be question and answer style between our featured speaker, Silifat Mustapha, and our host, Mary Beth Riley McGreen. While you're listening to the program, feel free to write your questions into the Q&A feature on Zoom, and if time allows, we'll spend some time at the end to answer your questions. Please note that we may not be able to get to all of the questions today. Now I'm excited to introduce our host, Mary Beth Riley McGreen. Mary Beth Riley McGreen is a content strategist and writer for the University of Rhode Island. She has won 7 CASE awards from the International Council for Advancement and Support of Education for excellence in writing. Most recently, she won a Gold CASE award for a magazine profile of Dr. Anthony Fauci. She has written about many of URI's most accomplished alumni and faculty, including award-winning journalists Christiane Amanpour, Vlad Duthiers, and Thomas Farragher, Tony Award winner Andrew Burnap, and ocean explorer Bob Ballard. Mary Beth, thank you so much for joining us again today and for hosting this program. I'll now turn it over to you.
Thank you so much, Paula, and it is my great pleasure this afternoon to introduce Silifat Mustapha, class of 97, and hear her perspective as a leader in the field of nursing. Silifat is Vice President of Nursing and Clinical Services at Unity Healthcare in Washington, D.C. She has held leadership roles in nursing for more than 12 years and has worked in the field for over 20 years. After receiving her bachelor's in nursing from URI in 1997, Silifat went on to earn a Master of Public Health and is currently studying for a Ph.D. While she has experience in a variety of disciplines, and she really does, her primary focus is in community health for underserved populations. So it's great to see you again, Silifat.
Good to see you too, Beth.
I'm really excited to talk. We did do a pre-interview, and I'm thrilled to dive in and also to kind of go into more depth about some of the things we talked about. And maybe we start with the fact that you don't come from a long line of nurses, but you did have that one grandmother. So could you talk a little bit about your personal history as it relates to the university and to nursing?
Sure. Thank you again for having me. I think this is a great honor, and being the last day of Black History Month, I'm super excited to be able to give this talk. So a lot of people ask, especially when you're a nurse, what made you become a nurse? What were your, and I didn't really have anyone in my family to, model. However, I think later I learned that my grandmother, on my father's side, my paternal grandmother, was a midwife in Nigeria. So she would, not formally, but she was the person who in the area, if someone was giving birth, that they would call, and she would help deliver babies in the area where she lived in Nigeria. So that's my only real connection of anyone in healthcare in my family.
I love that story. Well, so you're first generation Nigerian American. Could you talk a little bit about how you came to be a student at URI? And I understand you have a brother who's a graduate and your mom. So Can you talk a little bit about that?
Yes. So my mom is an alumni of URI. I think she was here when Christiane Amanpour was at URI as well, because Christiane Amanpour is a URI alum. And I remember as a little girl, walking in the quad with my mom. I still have pictures. I remember her graduation because although my parents migrated to the country, they came actually on a student visa to the United States in the early 70s. My mom, you know, it took time to graduate. She started off at Bristol Community College back then in Massachusetts, because we did live in Massachusetts before matriculating at URI. So she had myself, my second brother, and pregnant with myself, my brother, the oldest of the boys, and my second brother, pregnant with my second brother by the time she graduated. So she still has graduation pictures with a big old belly and the cap and gown and the, you know, the big sunglasses that were in style back then in the early 80s. So I remember walking the quad. I remember going to class with her at what is now the downtown campus, but it used to be called URI Extensions. It's now the Providence Place Mall, but it used to be URI Extensions back in the day. So I have great memories of that. My brother, my youngest brother, the youngest out of us, he is a URI alum as well. He got his bachelor's degree, but he's now a master's student for the cybersecurity program. And my ex-husband is also a URI alum and knows some of the people that I went to school with who he was in their classes. So we have a lot of family history at URI.
Yeah,
I'm a proud TD graduate, TD Nation, talent development.
very nice. So education a big priority in your family.
Absolutely.
Yeah. All right, we're going to switch gears a little bit because I know that in our discussion prior to this, we really wanted to talk about your research. So could you talk about your research priorities as they relate both to your PhD and also to the role that you currently have?
So when I relocated to Maryland in 2008, I took on the role of a nurse manager for a county hospital that serves the underserved population in Prince George's County, Maryland. It's not that I didn't get other roles. I had opportunities to work in Virginia and in DC. But my priority was to work with a population that I felt had needed, you know, to have people that they trust and people who look like them care for them. That's a big, you know, challenge in the African-American and the underserved populations and communities everywhere, not just in Maryland or DC. I currently work in DC, but that job was in Maryland. And it has a lot to do with my research because my current dissertation topic has to do with maternal mortality and morbidity in African-American women. And my goal is to understand, you know, why Black women are 3 to 4 times more likely to die during childbirth than white women, 2 to 3 times more likely than Hispanic women and Asian women. So the disparities are there. There's a lot that contribute to the disparities in childbirth, and not just death, but also poor outcomes during childbirth. So, you know, the data is out there, you know, it's well known, it's well documented, it's even advertised in different TV shows on, you know, the medical shows, New Amsterdam, The Resident, Grey's Anatomy, it's all, you know, in there, even, you know, in the art world. So, you know, it just really resonates with me. You know, I have a personal, semi-personal attachment to it. I have a friend who his wife died during childbirth. And he raised his 2 sons on his own, one who's graduated college already and is working, and the other one who's a freshman in college. So I have personal attachment to it, and it's not even the underserved population that go through this, but you know, we know about the Serena Williams story and how, you know, she almost died during childbirth because she felt unheard. And that's part of what my dissertation, my research is about. Overall disparities in African-American women, but right now it's maternal. And just looking at maybe there's communication gaps with African-American pregnant women and their providers, and understanding, why, these poor outcomes occur.
Just want to, I don't like this expression, but it's the one that's coming to mind, unpack some of what you just said. We hear terms like health disparity. I don't know that one of the things that was very helpful to me when we talked, you talked about what that entails. So we say health disparities and people have the concept of what's being said, but you talked about it, and I'm just going to read a little bit here for a minute.
Sure.
It's about the lack of the education to communicate with a doctor or another medical professional successfully. It could be about a lack of safe housing. It could be, or it is, not could be, health disparities, lack of good nutrition, because someone might be living in a food desert in a community where access to healthy food is not, it's not easy. They may have to take public transportation to leave their neighborhood to actually get what they need in terms of good nutritious food. It could be about safety. It could be that the neighborhood that they live in is not properly surveilled, so they don't feel safe. It could be that their own home is not a safe place for them. And of course, access to quality health care. So I thought that was really powerful how you kept framing it in terms of when you talk about health disparities, it's lack. And I don't know that everyone really thinks about it. Yeah. So in terms of your research, what's kind of the scope? How are you doing this research that's obviously so imperative that it be done?
Well, doing a lot of lit reviews, seeing what's out there, what has been written, what has been documented. But a lot of my research, hands-on research, will be actually interviewing pregnant moms and asking them, poignant questions about their communication with their providers. A lot of the feedback that I have read or that I have received from colleagues of mine who do this same kind of research, maybe in the Hispanic community, or compares Hispanic pregnant women with white pregnant women and Black pregnant women. When you look at African American or Black pregnant women, they feel unheard. So that was like a continuous, a theme with the research, with the question or the communication gaps that exist. So a lack of feeling heard. So they just give up basically on expressing their need. It comes from a long line of history. This is not anything new. We all, have read or maybe have heard of, historically during the times of slavery when Black women were enslaved. There's a famous OBGYN doctor that would use the women to experiment on different kind of surgeries and not use any anesthesia. And when these women survived, or, were not allowed to cry, were not allowed to scream, can you imagine having surgery and not having any anesthesia? And I mean major surgery, and not being allowed to, and surviving that. There's been historical thought, and this is not all, providers, but I think there's something where people think in the back of their minds that, people of color or Black women or Black people in general have a higher pain tolerance. No, that's not true at all. And the literature's out there. When you look at people who get or are offered and given pain medication for the same exact surgery to the same exact limb, same age of people, male, female, whatever. And, the studies and the research specifically shows that Black people are offered or given pain medicine less. There's all kinds of tests, the GFR test when it comes to kidney function, Black people, they're held at a higher standard when it comes to, what that looks like, and if they can receive dialysis or put on a list for transplant. Like there's a lot of disparities in healthcare outside of social determinants of health that affect people actually being able to receive or get healthcare. So there's so many things that that come into play, and it's very historical. People may not think that, you know, not being able to get fair housing, you know, because of redlining laws and, you know, fair lending. I mean, all of that, you know, leads to, you know, what, how people are able to, people are able to receive healthcare or understand it, or, you know, just give up, you know, because there's so many things happening at once.
And I'd love for you to just to kind of punctuate this. Would you talk about, it was Serena Williams, her experience as a pregnant mother, because there's a person who I think the world sees as an advocate on a tennis court. She's an advocate. She is going to speak truth to whomever she's addressed. You know, that's been her. That's been how we partially how we viewed her. And so this, you know, this story that you told me last time, which I know has been in the news, but for the benefit of those who may not know, would you explain what happened to her?
From what I know from the story is that she ended up with a blood clot. She was complaining of just not feeling well, just overall, something wasn't right. You know, something felt different. It felt weird. You know, that was her first child. I don't know if she was, you know, pregnant before, but, you know, something just didn't feel right. And they weren't listening to her until she, you know, I don't know if it was her husband, who happens to be, you know, Caucasian, you know, got involved before someone was able to actually do a full assessment of her and found that she actually had a clot. And that could have killed her, you know. So it's not really specific to people who are poor or lack education or money or finances or access. But, you know, it's not, you know, it's more impactful when it comes to someone who doesn't have the resources or the knowledge or the education or the ability, because of some of the things that I spoke of, you know, with you before, you know, whether they live in a food desert, whether they live in a built environment where there's no access to somewhere for them to walk. You know, some of the doctors may tell, you know, women who are pregnant, you know, make sure you get your exercise in, and casually just say, you know, make sure you exercise, walk 30 minutes a day. Well, I don't have any, they don't have any, they might not have anywhere to walk. You know, they could walk in their home, maybe up and down the stairs, but, you know, they don't have access to the gym or a park, you know, in their neighborhood, quite possibly. You know, I need you to, you know, decrease your sodium and eat this many milligrams of sodium a day because it causes high blood pressure, become preeclamptic, you know. But if there is no Whole Foods or grocery store in the area, that's almost impossible. You know, they get a salad at McDonald's, but, you know, how, you know, we want more than just that. You know, we have, even here where I am in Ward 8, where I work, a lot of my clinics service, you know, the most underserved populations. They just built the first grocery store in Ward 8, you know, recently. You know, how, you know, and I drove by it a few days ago and I was like, oh, there's the supermarket, you know, and it was thriving. You know, how sad is that, you know?
Absolutely. And I think about the story you told me of a friend of yours who went to the emergency room, was having a panic attack and was just ignored. So there's a step back from even communicating and being heard. They weren't even being addressed in that moment. Which, where does that, you know, it seems, again, where does that leave you? Do you raise a ruckus because you want to be, you know, and then of course there's implications to getting upset in a situation like that might not, you know, turn out the way you wanted to as well. So Tracy Dufault, apologies if I pronounce your name incorrectly, asks, Silifat, can you speak to the impact of racial bias and access to healthcare, quality healthcare?
Mhm. How does it impact? I mean, it becomes a problem where you you don't believe in the healthcare system. You know, you wait until you need emergency room services to even see a doctor or a provider. You know, and then that, you know, cycle, you know, moves on to your kids, and you know, it's just a detriment to your own health. You know, it impacts lots of things. It impacts the ability for you to be able to work or focus or study, you know, if you're in school. So there's a lot of implications that come with racial bias in healthcare.
Have you, in your experience, had mentors or been a mentor? Are you also, as part of your kind of leadership role that you have, looking to change things within as well as without? So change the patient experience is a compelling part of your research. Are you also looking at the institution and saying, all right, these are the things I need to do from my position to ensure that, or at least make less than it is now the biases that have traditionally been a barrier to women in terms of attaining leadership roles in healthcare?
I think starting to maybe change the culture, depending on where you are. Like for me right now, yes, improving the patient experience is a huge deal here, because we want our patients obviously to come here, because at the end of the day, it's a business, right? But we also want to provide the best healthcare and be the leading, you know, healthcare provider in the district. A lot of our employees, support staff employees, let me say, are part of the community as well. So they go through the same, you know, healthcare disparities and health illnesses that our patients do. So, and they, again, come from the same community that are experiencing violence, experiencing abuse, experiencing police brutality, you know, experiencing all kinds of things. So trying to train them on how not to react to patients when the patients, you know, come with their baggage, you know, because they're ill, and at the same time, they have all these other social determinants of health in the background weighing on them. You know, teaching them how to manage their emotions as well. But that's tough. You know, a lot of our support staff are younger. They're entry-level positions, but we have some great nurses. We have some great leaders as well, who are able to try to manage that, and other leadership roles in the organization that bring consultants to help us teach people how to manage that. And you know, we're trying to do the best that we can for our patients, but also for our employees as well.
Yes, especially in the last few years, I think it's become much more widely known how what a taxing discipline, what a taxing profession rather, nursing is.
Yes,
And
yeah.
I think you know, probably everyone in the audience today has seen pictures of nurses standing outside ERs or outside their wards and just looking exhausted by the demands of the job. Seems a nice segue to talk about, you didn't grow up thinking, you know, asking for a stethoscope at Christmas time. Could you talk about your path to your profession? So we talked a little bit about your time at URI, but it was in discussion with your mother that,
Yeah. So as a freshman coming in, I really was unsure about what I wanted to do. I've been was in the arts most of my time as a child, talent shows and dance and theater in high school, and dance in college. So I didn't really know, healthcare was not on the top of my mind, but my mom was just like, why don't you become a nurse? And I just said, okay. It was just as simple as that. And that's how I got into the College of Nursing. I kind of was, up in the air about it, maybe 2 years in, and switched my major to social services or human services or human development, whatever it was at the time. And I got bored. So I switched back to nursing because it was a lot. Nursing is a really, really heavy major. It's a lot to know. You have to know as much as the doctors, because if they make an error and order something and you give it, that's your license. So you have to know just as much as the doctors know. And, residents will tell you that they rely on nurses when they're just beginning to help them through their residency, because we probably know more at the time than they do. But yes, and people ask me all the time, is nursing your passion? What you doing, is it your passion? And I don't think it is. I don't feel like it's my passion. I'm just kind of going with the flow of life. I never really thought that I would be at this level of leadership in my career. I actually said I didn't want to be this level of leadership because it's a lot of responsibility, but here I am. But I think that what I realized, that it's my purpose. I don't know. I don't feel like this is the end all be all for me. I think that, when I got my master's in public health, that I thought, well, maybe I'll go into the government sector since I'm here in DC and there's a lot of government opportunities. Never really got in there, but just moved up with the support of my leadership and support of people around me, was able to move up. And I'm kind of just going with the flow. I feel like there's more for me. I don't know exactly what that is or what that looks like. I try to kind of, put it together in my head and be like, this should be my next step. But I really don't know. So, I mean, I don't know. People ask me that all the time, like if it's my passion, and I'm like, no, I just think it's my purpose right now. Yeah.
Actually, that is the answer. That is a question that I often ask people, and the answer varies, but I really liked your honesty in the moment, saying, no, I feel compelled to do this. I remember you told me about, I'm going to get the name right, the flavor unit. You want to talk to a little bit just about what, I'd rather you talk about what that was than me. Something
Yeah,
that you were right.
That's a dance team that one of my best friends and another colleague and myself created when we were undergrads at URI. We would dance during halftime of the basketball games. We actually got financed and funded by the athletic department. And it all stemmed from disparities in people who looked like me, who were shaped like me, and were unable to be successful at joining the cheerleading squad. I didn't try out for the cheerleading squad. I'm not a cheerleader, but my best friend, Denise Holder, who was a year ahead of me, we went to high school together. She also was a cheerleader in high school. So that became, something that we were like, hey, maybe we should try to do something on our own. There is, I think, majorettes or some other kind of dance team there, but, we kind of put our plan together and we presented it, and, we got uniforms, we got jackets, we were able to go on to the March Madness trips. We went to some of the games. We danced during halftime at one of the games at Temple University. So that came as a result of, kind of being, we felt at the time, discriminated upon. So we took action and we were successful. It ran on for a few years and then was picked back up some years after, but I don't think it's in existence at this time, unfortunately.
I don't know either. I will find out for you and for me. Yes, I loved that story, and I thought another thing that you in the same moment you talked about your favorite class was actually Introduction to Jazz.
Yes.
I thought I guess I don't have the name of the instructor.
Yeah, I couldn't remember his
Okay.
name. But it was because I love music. Again, as I said, growing up, I was kind of into the arts growing up, and I absolutely love music. I always tell people, and I hope this never happens, but if I was ever into a coma, I think the only way I would be able to be woken up is someone played music or put headphones on me, because I absolutely love music. I jam to music on my way to work in the car. I'm that person who's singing out loud Jill Scott or Mary J. Blige while I'm driving in traffic in DC. But that was one of my favorite classes, and I remember getting an A in that class, and it was just so easy for me to learn. I did play instrument in middle school. I played, and I was in choir, through elementary school, middle school. I played a clarinet. Both my sons, I have two sons, played instruments. One plays an instrument, currently he plays 5 different instruments, and is probably, hopefully, knock on wood, going to get a band scholarship to college. It's again, not my family. I know my father was into music, definitely. He had thousands of albums. When I say thousands, I mean thousands of albums. Him and my uncle used to compete on who can get this album. And my dad was a jazz connoisseur, so he loved jazz music. So maybe that's where it came from for me to really be successful in that class. And I think I only didn't go further because, my parents being, immigrants from another country, their focus is on getting a job that's going to really pay you and not have to really struggle. And I didn't think, she didn't want me to be like a struggling musician or anything. So maybe that's one of the reasons why I chose nursing, or she talked me into nursing. But I did really enjoy that jazz class, Introduction to Jazz.
Well, I ask it for a reason. But I just want to say Just Fine by Mary J. Blige, one of my very, very favorite songs. I love that song. But I bring it up because when you talk about with the flavor unit and loving jazz, the thing that kind of comes through for me is these are comments that a creative person makes. And of course, with jazz, there's, it has a strong history of improvisation.
Mm-hmm.
And I'm wondering, and you can say, no, Mary Beth, it has nothing to do with anything. But in terms of your leadership style, in terms of purpose, passion versus purpose, and your interest in the arts, have you in your professional career embraced a leadership style that is similarly creative, or are you a person that thinks outside the box, to use a cliche, which seems really antithetical to a discussion about creativity, but as a leader, are you looking for creative processes and solutions to things?
It's funny that you say that, because I don't think of myself as being very creative. I am very black and white, kind of. I wish I had that brain that had that creative piece to it. I think it's called left-brained. I'm not sure if it's left or right-brained, but I don't. I rely heavily on other people to provide me with that outside of the box thinking, because as a leader, I welcome input, from my staff. I don't make decisions on my own. I always rely on their input, because I feel like collaborative thinking and processes, when you incorporate others' ideas into something that's going to happen, you get more buy-in. Right, they'll be more apt to be conducive to buying into and agreeing to it, because they had a part of that decision making. So I learned that was, a great strategy, but I think that's naturally me too. I'm not someone who, just says do it because I said so, except for my kids. But I am definitely someone who welcomes outside of the box thinking. I have a really good friend who He always has a different perspective that I always appreciate. So I always run things by him, not necessarily work related, but things that are maybe, happening around, happening around the world, or, in our society, like, with the killing of the recent killing of the young man who was killed in Memphis, and with when Damar Hamlin was injured during playing football. Someone had really something to say about, if he wasn't gonna, because at this time he hadn't come out of being, he wasn't well yet. So people were talking, in the football world about his contract and how he's only getting paid this much, and that's so unfair, and the NFL this, NFL that. And, the reality is that, he knew what the contract was before he signed it, and he made that conscious decision, he and his family or whoever was involved, to sign on that contract. And that there's a risk of injury when you play such a, a high impact sport. So, instead of always going with the green, I always try to look at, outside of the box. And if I feel like there's got to be more to it, I'll punt it out to my expert outside of the box thinkers to help me with perspective.
So you have a little crew of people who are kind of helping you on this leadership journey that you find yourself. Has this been a motif of your life, that there have been people in your life that have really kind of demonstrated for you the kind of leader that you look to be, someone who is, don't want to put words in your mouth, but someone who is collaborative, someone who is seeking other people's opinions, somebody who's trying to build consensus as opposed to maybe a more top-down management style?
No, I think that's just naturally me. I think I'm just naturally like that. And it's oddly enough, only because I say that because I'm the oldest child and have always had to make decisions my whole life. Being a Generation X person, and being a latchkey kid and not relying on others to make decisions except my parents, but I have always been responsible since I was very young. And in, even helping with my parents, with my younger siblings. So I, even though I've always had to make decisions, and, I think it's natural for me to now in my adult life want other people's input, so I don't always have to make the decision, because it can be exhausting, having to be the only one to make all of the decisions. Yeah.
Do you, in your leadership role, in your role as a scholar, do you see an opportunity to shape the healthcare system? And kind of piggybacking on that question, I'm going to ask you a second question too, which is, what would be an ideal healthcare system, especially for the subset of patients that you are most concerned with?
I think right now, it would be great if everyone received the same kind of healthcare equally, and they had to receive the same benefits, and were able to, receive the same thought of importance when it came to healthcare. I'll use the example of when the pandemic started, right? When we were running, let's say in New York, I know this happened in New York, hospitals were running out of ventilators, and the doctors or the powers that be at the hospitals had to start making decisions on who would get the ventilators, right? And the ventilators were going to the people who had the best chance of surviving. But the people who had the best chance of surviving were not the disparate, population, because they were already losing, because they already had multiple chronic issues that were not addressed or that they couldn't attend to, not having preventative care, not having, resources to be able to get to the doctors on time, not being able to have that surgery, at the top hospital, having to go to the community hospital maybe that didn't get as much resources or funding than, the big hospitals. So they were already not going to be able to be eligible, unfortunately. And it is not because they weren't worthy, because at the end of the day, it had to do with racism, not race. Racist, at the end of the day. So the how do I want to say it? Like what it looked like was that the healthiest people happened to be, white
Right.
people who were healthier because they had better access to healthcare. So that's, I would like it for, that maybe, looking at things like that to be looked at differently. You know what I mean? So that everyone has a fair chance. There's this, I don't know if it's a kind of, it's like a picture, where you have three people standing up looking over a fence. But below the fence, it's different levels. Because if you give everybody that same fence, that same level, everyone still won't be able to look over the fence, right? You have to, somebody might be shorter. If someone's 4'11", someone's 5'6", and someone's 6'3", you can't give everyone the same level to look over the fence. You have to bring everyone to meet them where they are to be able to look over that fence. So I think healthcare has to model that exactly. If I could show a picture of that so that people understand what I'm talking about. I mean,
Yeah,
I hope it makes sense, but you know what I mean?
It does to me. I've seen that
Yeah.
that very illustration that you talk about.
Yes.
And I do think it is a really, in a moment you understand.
Yeah.
I think you did at the outset too, when we were talking about the social determinants, that a person, the invisible social determinants that a person presents when they're in an emergency room. So you mentioned earlier that some people are, for various reasons, aren't coming to or aren't seeking the aid of the medical profession until it's crisis time.
Yeah. Right.
Yeah. That I think that you scaffolded well how different two people coming into an emergency room may present, and then there are decisions being made based on presumptions about how healthy they are, and many other aspects of the lives they've led that are being weighed in that moment. When in truth, how we should be looking at it is we have two hurting people here. How do we address the needs of both of them? Right.
Effectively and efficiently and enough for each. Yeah.
Yeah. And in a reasonable amount of time. I just wanted to share with you in the Q&A, there was a comment from someone there, anonymous, but they said of you, what a humble, honest servant leader with a purpose.
Oh, thank you.
Yeah, that was very nice. Anonymous person. Thank you for that. So we talked about where you'd like to see healthcare go. I think what I'd like to know is what can all the rest of us who maybe are not, not healthcare professionals at all, but are feeling feeling the pain inherent in what you're talking about. You're talking about research, yes, but the research is in part looking into people feling that they're unheard, that they cannot communicate effectively with an impersonal healthcare system, or a healthcare system that has either a predisposition or is in some cases is operating under myths about how healthcare should look to people of different ethnicities or socioeconomic backgrounds, which I find amazing and appalling, and at the same time, not surprising. When you talked about, different presumptions that are being made about patients, that have nothing to do with anything biological or
Right.
psychological.
Yeah. Mm-hmm.
So long-winded question is, what can the average person do? How can people who are moved by what you're saying make a difference? Try to improve the quality of healthcare for all.
I think they should start by being an advocate for themselves and for their loved ones when they are ill. Encourage one another to seek preventative care and not wait until, it's a crisis. Accompany your elderly parents if you can, or, loved ones to doctor's appointments, and making sure that, even if you have to write it down, ailments or things and demand, that you be heard, and demand, for all of the information to be received and documented, because you just can't do that enough for yourself. I mean, because when people do that, they still get ignored. There's a nurse who worked at Walter Reed recently. I read an article. She worked at Walter Reed Hospital, a nurse, and complained to her doctor about something she felt in her breast. They were like, "Oh, it's nothing." 4 times, she said 4 different doctors. Maybe not 4, but 4, multiple times, went to different doctors to get first opinion, second opinion, third opinion. And it turned out she ended up with stage 4 breast cancer. And it was, malignant, unfortunately. And she's a healthcare provider, never mind, a layperson. So, and that broke my heart. I mean, but that happens. So it happens so much. So I would just say, continue being an advocate for yourself, for your loved ones, for your children, because people may not be able to pinpoint exactly what's wrong, but they know something's not right, and, providers are busy and they see multiple patients. I think another thing on the healthcare side that can be done is for every state to be able to allow nurse practitioners to be primary care providers for primary care for patients. In 14 or 15, when the ACA came into effect, America's Affordable Care Act, came into effect, Obamacare, a lot more people were eligible for healthcare. So, they were signing in, places of employment were held to the standard of making sure that you offered healthcare. So a lot more people became eligible, but a lot of doctors or, students, medical students, don't go into primary care because it doesn't really pay that well. So, it doesn't pay as much as, a surgeon or a specialty doctor. So I think if we allowed, opened it up to more, nurse practitioners to be healthcare providers in primary care, not all specialties, because, sometimes you need MD for that. I think it would open it up, for people to be seen, sooner. Like, I made an appointment with my eye doctor. Like, I'm supposed to get an eye appointment every 6 months because of medication that I'm on. My appointment is not until June. So, I mean, healthcare is really, really, strangled right now, for lack of a better word, but advocate.
Mm-hmm. No, I agree. I just, the other day I was signing up for a patient portal after calling an office. I didn't get a person on the phone and I was directed to the patient portal. I went to the patient portal and it said, you need information from your provider in order to register for the patient portal. And I was just like, I can't imagine. Right? Yeah. Like an 80-year-old man or woman.
Oh,
trying to navigate this. It was just, I could take a breath. I wasn't in, a crisis situation, but I hadn't thought of that in terms of what the average person can do. And that would be something like check in with your parents and make sure that they're staying on top of their own healthcare. And so thank you for that. I guess my last question, I think we have time for it. I'm presuming that there are nurses who are watching this. I'm presuming there might be students in the College of Nursing that are watching and would be guided by you. And I just would wonder what if you could give them, one piece of advice as they either move through their own professional journey or anticipate becoming a nurse or a PA or any number of other options. What you would advise them to do with their careers?
Two things. I would say, for new nurses coming into the field, being a nurse in the hospital, really hone into that empathy piece that you have or might have, or try to develop it. Think about the person who you're caring for and think about them as the person you love most in this world and how you would want them to be treated. That's how you should treat every patient. Some patients will give you a hard time because, they don't feel well, or that's their personality, but you should still treat them as, your most valued loved person, that you could think of. Secondly, I would say, understand why you want to become a nurse. And if you are going to work in the underserved population, you need to be able to gain trust from your patients. I hear nurses, and because I'm on, Facebook nurse groups and all this stuff, when nurses say, I treat every patient the same, you cannot treat every patient. That's poor nursing. You cannot treat everybody the same. You mean well, maybe they mean to say you treat everybody with dignity and respect. Yes, do that. But you can't give the same amount of attention to every single patient. You just can't, because it's no cookie cutter way of providing care to a patient. Some patients need more attention, more care, more, of everything than others so that they feel heard. Everybody doesn't have, someone to drive them or an Uber account. Some people, and not everyone also has to take 2 buses and walk or find daycare or find childcare or, for their appointments as well. Or, when they're in the hospital, have someone to actually take care of them, in the hospital. But you should, as a nurse, never say, I treat everyone the same. No, treat everyone with dignity and respect, but treat every patient as an individual and treat them accordingly to their needs.
I think that's a beautiful closing statement. Everyone with dignity and respect, everyone according to their needs. Thank you so much, Silifat. This has been an education.
This has been awesome. And I definitely a good mix of sharing your wisdom and thoughts and your sense of humor, which I really appreciate. So thank you both for that, for this great conversation. And to those of you that joined us today for this webinar, thank you for taking time out of your busy day to join us. This event is the 3rd of the series for this academic year. Our next program will be in March, and will feature Lisa Wayant, who is the director of the Interdisciplinary Neuroscience program here at URI. In the coming days, you'll receive a brief survey about the program. Please complete the survey and share your thoughts on today's program so that we can bring you more like this in the Women in Leadership Speaker Series. So thank you all again and enjoy the rest of your day.
Thank you. Thank you for having me.
Thank you.
Bye-bye.